about the public health of New Yorkers, making sure that people can afford to stay home when they're sick or their loved family member is sick, so that our entire city is healthy. New Yorkers, interestingly enough, can go to a restaurant and note the type of restaurant in terms of A, B, C, but you know what? Somebody can be sick in that restaurant because they don't get a day off to take care of themselves or their child. There's something wrong with that picture. And so to ensure the competitiveness of small businesses, to provide flexibility for owners, and to minimize their administrative requirements, our coalition has come up with 12 amendments to the Paid Sick Time Act, and they include, as an example, the bill will now not apply to businesses with less than 5 employees, but it will provide job protection. They won't get fired if they get sick, which is incredibly important. That's a change. And under this amendment, 62% of small businesses will be exempted from providing paid sick leave. But it is clear, however, that 15% of working New Yorkers without paid sick leave, that's the only amount that is in those 62% of all businesses. So all other workers without paid sick time in the city of New York would be covered. The amendment is a big compromise, and it takes into account the needs of small businesses and creates a paid sick time bill that will bolster the economy by protecting small businesses and jobs. I also want to mention that new businesses with less than 20 employees will have a 1-year grace period before they have to start. I would like to now introduce Julissa Ferreras, who's going to say a few words, and then we will have some of our wonderful speakers again. Thank you, thank you, thank you.
I'd like to thank Councilmember Gail Brewer for her leadership. This showing today required a lot of work from a coalition that has not stopped. And we're very excited and eager to be able to find a day when New Yorkers have a paid sick leave. Just last week I was very ill, and my doctor told me to stay home for a few days. But that is not the reality for 1.5 million New Yorkers. Their doctor tells them that they can stay home, and they can't. They can't because they fear losing their job. They can't because they can't stay with their child. As a former Beacon director, I saw many children bringing their medicine to school so that they could take it by themselves. And that is a reality that our families face here in New York every day. I am proud to lend my voice today to the chorus of voices calling for paid sick leave in New York City. Paid sick time is a small measure that can have an immediate positive impact on business productivity, reduce unemployment, and strengthen financial security for families who desperately need it. Supporters of paid sick leave are here today from across the spectrum. We have labor, small business owners, community-based organizations. And yes, it is no secret, and it is unfortunate, that Latino community is desperately in need of paid sick leave. Low-income Latinos are the least likely to have it. 7 in 10 do not have paid sick time. It is especially helpful for low-income women, and many of you know that I am the chair of the Women's Issues Committee. Working women, mothers, face a double challenge because they usually have to care for their children. They should not be forced. Even God is upset we don't have paid sick. They should not be forced to choose between their health or the health of their children or losing their jobs or family income. Women have greater health care needs. We need to take the time to go to special appointments and screenings necessary to maintain good health. This is a reality for New York women. And as we talk about our amendments, it will provide protection for both business owners and their employees. Any type of paid leave, paid time off, vacation, personal days, etc., counts as a paid sick time. Businesses that prefer not to designate specific time to the same amounts are required by law need not change their policies. Businesses will not need to change their bookkeeping practices. We are working. We heard the businesses, and that's why we did these amendments. Now we need the City Council to pass this. Thank you very much.
Thank you, Councilmember Ferreras, for taking the initiative, and I'm so encouraged. I really am so encouraged to see such a broad coalition of folks, my labor colleagues that are out here, our coalition partners and our allies in this effort, and coming out today in support of this much needed legislation. Our sign's going to blow away, but I don't think our momentum is going to slow it down at all here. The time has come to pass the sick time legislation. It's smart public policy. It makes sense from an economic standpoint, and it makes sense from a public health and safety standpoint. No one in this city should have to choose between caring for a sick relative, a sick child, or themselves, and between their financial well-being or losing a job. This is incredibly important legislation, and we need to keep our focus and attention on that. This legislation is going to reduce health costs. In 2010 alone, according to some conservative estimates, there was over $1 billion spent on health care costs that could have been avoided had people been provided with this level of benefit, this paid sick time benefit that so many of us have, but so many of us still lack. So we need to focus on reducing the cost. The fact that so many workers do not have paid sick time and can't afford to lose a day's pay to visit a clinic or to visit a doctor during regular business hours is also filling up our emergency rooms during after business hours. There's so many things that we don't take into consideration because people aren't provided with paid sick time. It's going to create a fairer and a more level playing field for those employers who already are providing sick time, paid sick time to their employees, and other cities, as we know and as we've heard and as we've spoke about, are providing it. We see San Francisco, for instance, and other cities throughout the country, and they've provided this. They've been providing this level of benefit for years now with no negative economic impact that really of any substance that we can know. Ultimately, the bottom line is it's going to reduce the burden on taxpayers ultimately for the unnecessary health care costs that we see and the spending that is increasing because of the people who right now do not have paid sick time. It's good for workers. It's not going to harm business, and it will help preserve a level of dignity and a level of respect that every worker in this city is entitled to, every worker in this city needs, and every worker in this city deserves. This is a process that is going to be ongoing, and the Central Labor Council, its 1.3 million members, its 300 affiliated organizations are all going to be proud to stand with this coalition and to make sure that we arrive at a conclusion where we provide paid sick time for all the workers of this city. Thank you, and thank you for all the workers.
Next, we're going to hear from Courtney Lamar, who's Vice President of 1199, and I want to thank 1199 not only for all of their support, but also for a great article in the Amsterdam News. All right.
On behalf of 1199's President George Gresham, I'm standing in. Unfortunately, he was unable to make it in town on time for this most important event. 1199, while we had supported the legislation in the past, had decided that it was time to become much more active in getting this legislation passed. As representative of a union that services 375,000 healthcare workers throughout New York and the East Coast region, we feel that it's past time, it's way past time, that such legislation is passed here in New York City. We feel that this is going to be a model for many other cities around this country, and we feel that it's important to take a stand, a more active stand, and make sure that this legislation is going to be passed. We fully support the passage of this. As healthcare workers, we understand the importance of securing our workers' rights to healthy, and to become healthy individuals, to maintain healthy families, and help in maintaining a healthy society. Supporting and fighting for a healthy New York is crucial. Our mayor talks about a healthy New York. Our companies talk about healthy New Yorks. It is time that we all get on board and talk about a healthy New York and what impact this legislation is going to have. Paid sick time will keep our schools, our restaurants, our public facilities healthy and safe. And it will help, as you've heard already and will continue to hear, help reduce unemployment and make sure that our economy is strengthened. As part of 1199, it's important to also recognize that we have about 20,000 home care workers who will benefit from this legislation. People who service the elderly, people who service the poor and cannot take a sick day to take care of themselves. And we feel that this is urgent, and we expect that our city council is going to fully support this legislation so that we can move on to other endeavors. Thank you.
Who are kindly here: Councilmember Mark Riverino, Councilmember Crowley, Councilmember Drum, Councilmember Jane, Councilmember Lander, Councilmember Bremer, Councilmember Chin, Councilmember Rodriguez. Thank you all.
And as I mentioned earlier, this is a diverse coalition, and now we want to hear from our small businesses. I'd like to introduce Edgar Andrade, business owner of the Wyckoff 99-cent and hardware store.
Yes, we can! Yes, we can! Yes, we can! Yes, we can! Yes, we can!
We've been joined by Councilmember Lappin, Councilmember Eugene, and Councilmember Williams, and we heard from Councilmember Levin. He was here earlier. Now we have the great pleasure of introducing Dan Cantor, who is the Executive Director, Working Family Party. Thank you, WFP.
I'll be very brief. I want to acknowledge Make the Road, 1199, USCW, everyone else who is here, and the members of the council, and especially our tenacious champion, Councilwoman Brewer. We were here a year ago. We got close. We thought we were going to finally see passage of sick days about a year ago. Politics is hard, so we come back now, a year later, but things have changed. Connecticut became the first state to mandate paid sick days on a statewide basis in the last year. Seattle, Washington passed paid sick days. Something called Occupy Wall Street showed up and taught us a little bit about what the 99% needs to stand for. And I think you're seeing today that we are united. But a year later, if you're working at McDonald's or Burger King or Wendy's or Kentucky Fried Chicken or Dunkin' Donuts or Popeyes or you name it, more likely than not, you do not get paid sick days. So very simply, we call on the Speaker, we call on the City Council to honor the golden rule of politics. Do unto others as you would have them do unto you. Unless you're willing to live and work without paid sick days, don't ask other people to do it. Thank you very much.
Thank you. We're very honored to have Dr. Llewellyn care bill. Thank you, Doctor.
Good afternoon. This is a social justice issue, and I am proud to be here with all of you, mothers and fathers, brothers and sisters, grandparents, because we all need to take care of our communities. I am proud to be here in my capacity with SEIU, my brothers and sisters from 1199 and 32BJ, and I am here as physician chair of SEIU because your doctors are standing with you. The 6,000 doctors of the Committee of Interns and Residents of SEIU in New York, and the 3,000 doctors of Doctors Council of SEIU. We are here today to talk about what it means to be a doctor. We've heard a lot of people say what happens when you talk to your doctor and they tell you to stay home. Well, let's hear it from the doctor's perspective. I'm here. We've been working with our unions, and we've been working hand in hand on this bill with groups like the Public Health Association of New York City and the New York chapters for the National Physicians Alliance and Doctors for America. You put that all together, all of those doctors, and it only means one thing. When it comes to paid sick days, your doctors are on the march for you. We are on the march because the question of paid sick days is an open and shut public health issue. We're here today to tell your city council members and the members of the press exactly what we tell you when we see you in our exam rooms. If you're sick, you should stay home and take care of yourself. If you're really sick, you should come see a doctor. And that's it, the end of the story. Right? Thank you for laughing, because you know that's not it. It's not the end of the story. If you're worried about losing a day's wages because your company doesn't offer paid sick days, or if you're worried about getting fired if you can't come into work, that's not it. It's our responsibility as a society to make sure we pass the paid sick days bill for us all as a just society. And doctors know this better than anyone. We worked in the hospitals when the H1N1 virus ripped through New York a few years ago, and we know exactly how quickly viruses, the flu, and contagious diseases can be transmitted when so many who work ride the subway, prepare and serve food, and take care of children and seniors. They feel like they have to report to work, even when they're sick. We've seen the single working mom in tears as she brought her 7-year-old daughter into the ER at 11:30 at night with a severe asthma attack because she couldn't switch her shift or take the day off to get her daughter the care that she needed for her life to breathe. We've seen the patient with an immune deficiency condition for whom that bug going around the office could be a life or death situation, but who felt trapped at work because he was living paycheck to paycheck. And we've seen far, far too many patients wind up in the emergency room, the most expensive and least effective place to receive care, because they held off receiving the care they need because they were scared. So let me tell you what, here's our prescription as our doctors, as your doctors. The time is now to get this done. Passing the paid sick days bill isn't just good for the 1.5 million workers who will gain that extra security. It's good for the health of all New Yorkers. Thank you very much.
Also by Councilmember Neely from Brooklyn. Now I'd like to ask David Jones from the president of the Community Service Society and defend Nancy Reagan and the cuts CSM.
I'll be very brief. We really want to thank the members of the council and Gail Brewer in particular for standing up on this issue. This impacts 1.5 million New Yorkers. As has been mentioned, 3/4 of Latinos, working people, low-income people are not covered. 50% of African Americans who are working poor are not covered. And I feel this is kind of outrage. My organization, the Community Service Society, is 170 years old. The same arguments that are being used to oppose this bill were used to oppose things like child labor restrictions, OSHA, workplace safety, minimum wage, and it becomes a real sense of setback that we can't get this thing passed even quicker, because this is out an outrage in the city of New York and in a democratic country, allegedly the most forward-thinking and progressive, that can't get this basic right to its working people. So we stand with them, and we stand with the council, and we seek passage of this bill as soon as possible. Thank you.
I would like to ask the great Pat Purcell, political director, UCFW. We love him.
Thank you. You know what? I don't need a coat because I have paid sick days. Okay? Unlike thousands and thousands of other New Yorkers who don't have it. Okay? Let me first say it is great to be here with this all-star team of council members behind us, and I want to thank them on behalf of our 23,000 members of Grocery Workers Local 1500. I especially want to thank who I now consider the Norma Ray of paid sick days, Council Member Gail Brewer. And in that fight, Norma Ray won, and in this fight, so will Councilmember Brewer. We've got great leaders here, Vinny Alvarez from the Central Labor Council, Dan Canner from Working Families Party, and all of these wonderful people behind. This is a great coalition. Cheering warms me up, so we can cheer about help. Look, I'll be brief. I just simply want to say that, look, the paid sick day train of success has pulled into New York City. In Seattle, in Connecticut, they've been able to make great progress on this issue. And now it's come here. And I have absolutely no doubt that it will lead New York onto its next destination with a win and passage of paid sick days here in New York City. There's no question that this morning a worker woke up and was sick and went to work. That is without dispute. There is no question that that worker then went into work and in some degree had contact then with other people. There's no reason that worker should have to decide whether or not to go to work or lose my job or not get paid. That is not good for any segment of the economy. That is not good for any business. That is not good for any New Yorker. The passage of this bill will be another step as New York City continues to show the world we are the center of progress. We are the center of doing what is right in a reasonable, smart way. We can do this. Our local union and its 23,000 members, again, strongly support passage of the paid sick days bill and look forward to working with all of these wonderful people over the next few months to get this thing done. Thank you, and thank you, Councilmember Brewer.